Assalamu alaikum. Good morning, student. Well, I hope you people are fine, and let's move towards the lecture. My today's lecture is from the chemistry subject, grade 10, and the topic is waterborne infectious disease. The waterborne infectious disease, as the term indicates, the disease that is caused by the drinking of contaminated water or eating the food which is prepared from the contaminated water. The two major reasons that causes the um, waterborne infectious disease. Now, the water pollution is mainly caused by the two major factors. One is the toxin, the chemicals or the poison that may be the arsenic, lead, mercury, any other elements which are poisonous. And the other one is the microorganisms, the viruses and the bacteria. The third cause is the lack of the hygiene, the proper sanitation system. Improper sanitation system become the cause of waterborne disease. Now let's move towards the different disease that arises due to the contaminated water, usage of contaminated water. In this, the first one is the diarrheal disease, which is also known as intestinal disease, and the cholera is an example. And in the diarrhea, as we know, dehydration occur, and the cause is the same, is the usage of contaminated water. The other one is dysentery, the another intestinal disease, and mainly because of the two major organisms, bacteria and the parasites. And what happened in this disease is the same, the diarrhea, the blood and the mucus, it happens together. The third one is the cholera. The cholera is basically an acute infection. Acute means the one which occurs with some major symptoms and need immediate medical attention. It's a type of acute infection, and it is also a gastrointestinal disease. And it is also the cause of the because of the contaminated water, usage of contaminated water. And the bacteria which is involved in the spreading of cholera is Vibrio cholera. Cryptosporidium, the cause of this disease is the protozoa, and the protozoa is, the unicellular organism. For example, amoeba is a protozoa, and it is also a gastrointestinal disease. And what happened in it is the diarrhea and the vomiting, and it is a waterborne disease, and it majorly the protozoa majorly found in the rivers, lakes, and other water reservoirs. The other disease is the fluorosis, and the fluorosis is basically due to the cause of excessive use of fluoride. And what happens after that is your bones and teeth get damaged. Then the hepatitis, the liver problem, in which there is inflammation of the liver, and there the causes are the five main viruses: hepatitis A, B, C, D, E, and the cause is the contaminated water. Hookworm disease, majorly you people can see this in the children, and it is basically a parasitic disease caused by the parasites. And what happened in it is the infection in the small intestine, as a result of which the organism become anemic, lack of blood, and growth becomes stop the growth, and it enters in your body through the skin. The second last is the jaundice, and the jaundice it's basically happens when there's an excess of bile pigment in your blood. Liver got affected in the jaundice, and your eyes become yellow, and you feel weakness and fatigue. The last one is the typhoid. Typhoid is another bacterial disease caused by the same cause, use of contaminated water. So these are the some of the waterborne disease with their symptoms and their causative organism and their different causes. Now the question is, how can we prevent these waterborne disease? We can prevent the waterborne disease in a very simple way. First, we should provide the safe water, the properly treated pure water. Then we should dispose the sewage in a proper way rather than directly or indirectly dispose of on the land or the water reservoir. The best way is the proper disposal. And the last one is the control of different toxic chemical, like we can control the use of pesticide, insecticide on the crops. As we know that these toxic chemicals, they are very harmful. They cause acute illness, they may be poisonous, and they may cause cancer. They may be carcinogen, means cancer causing. So by this way we can prevent the waterborne disease. Okay, here is the question, a very famous short question. Define chlorination. Chlorination is a process by which we add the chlorine in the swimming pool to clean the swimming pool or to disinfect the swimming pool, and it kills the bacteria. But the question is how. The chlorine itself doesn't kill the bacteria. Basically, it dissociates into the hypochlorous acid and then HCl. The hypochlorous acid further dissociates into H positive and OCl negative ion. Then this HOCl and OCl negative ion, it kills the microorganisms, bacteria, anything, any organism present in the pool water. So in this way, it disinfects your pool water. So it is a question, you can write it on your notebooks or you can on your books as well. Choice is yours, but the question is very important from examination point of view. And the other thing is, this topic may came in the board, but in this way, like the examiner may ask, like define waterborne disease and explain any 5 waterborne disease. In this way, this topic came in the paper. Come in the paper, so it's not unimportant, it's very important topic. So student, this is the end of the lecture, and take care. Bye bye.